One of my patients told me about her daughter's story. When she was the age of 15, they found her spine has some curve from side to side. They went to hospital, took an x-ray, and the doctor told them she got scoliosis. And doctor kept talking about the treatment process. What the person suggested to his patient was shocking. Put an apple on top of the daughter's head and walk for 10 to 30 minutes every day. That is what doctor said. Surprisingly, they believed it. They had done walking with the apple for several months religiously. I'm not going to talk about ignorance from both sides. Critical thinking will save your time and money. This video is the second part of the previous video. Hello, Dr. Joe here. I will explain about two types of scoliosis in this video. One is functional and the other one is structural scoliosis. How to know which one is which? The answer is from X-ray. Scoliosis is generally exhibits pelvic distortion. It will make similar pattern to above spine, which cause side-to-side curves, usually on the right curve on the thoracic and left curve on the lumbar. Both structural and functional scoliosis could have large curve from side to side. Functional scoliosis could go to structural scoliosis if patient has this type of spine long enough. I will explain this part with functional scoliosis. Let's talk about structural scoliosis first. People refer this as congenital scoliosis, not 100% accurate, because some cases of functional scoliosis could remodel themselves into structural scoliosis. But most of the time, it is correct. In this case, structural scoliosis, bone itself has some abnormality/deformation when they develop its spine. There are a few types of bone deformity pattern on C2 through L5 and also pelvis. At the segmental level, if there is a spine segment that has some height difference from side to side, he or she going to have some curve from side to side. I mean, it has to be like that. Otherwise, this person is going to be sick due to nerve pressure. Within the pelvis, a big rotational pattern or anatomical leg length deficiency could cause scoliosis. As I told you guys in the previous video, don't think all the scoliosis is problematic. Unless cups angle is not getting worse and nerve pressure is not happening by the curved spine, they are normal variant. If I put all these points above in a nutshell, to summarize, structural scoliosis is happening due to bone malformation/deformity. Besides extreme cases like the spine is a pressing internal organ, most scoliosis is normal variant. However, if curve causes nerve pressure, it will lead to dysfunction and pain. A chiropractor will help them to fix misalignment that causes nerve pressure, then making pain and dysfunction. Now let's get into the second part, functional scoliosis. Since they don't have bone deformity in the beginning, this one refers to as acquired scoliosis. Usually pelvic distortion causes an unstable foundation on our spine first, and then the rest of the spine adapt to unstable pelvis. Spine segments start to change their position to rotational orientation. Definitely the attached muscle would change its length, and more importantly, this type of changes could cause nerve pressure. The nerve pressure would cause more problem to the muscle. It is going to make its own bad circuitry. Tightness gets worse over time, and the spinal curve from side to side goes worse over time. Related symptoms is getting stronger. This is one of the reasons why people call this condition as a neuromuscular scoliosis. This functional scoliosis could be caused by micro or macro physical trauma from daily bad habit and injury or accident or heavy one-sided activity. If functional scoliosis is staying long enough in a patient's body, it could change to structural scoliosis. Due to Wolff's law, loading on a particular bone increases. The bone will remodel itself over time to become stronger to resist that sort of loading. Within this sentence, remodel is an important word. If the spine is stretched and pressurized on one side or the other, it will change its shape over time. Okay, these are brief information about functional and structural scoliosis. In general, side-to-side curve decreases spinal stability. I recommend you talk to a qualified physician if you see some of the signs and symptoms that I described in the previous video. I hope this is informative to you guys.